So is it safe for pregnant women to get the COVID vaccine? One UAB doctor says that new findings are reassuring. Our Nixon Norman has more on the report.
Unfortunately, women who are pregnant who get COVID-19 have a higher risk of having severe disease. If you look at the priority groups that the CDC recommends for vaccination because of that risk, obesity, diabetes, hypertension, pregnancy is on that list as well.
The CDC opened up a registry so that pregnant, vaccinated women could give them real-world data.
About 19,000 of these women got Pfizer, and about 16,000 women got the Moderna vaccine. These are both mRNA vaccines. And when they looked at safety of the women and safety of the babies, it looked very reassuring.
Although she only mentions the 2-dose shots, she says that pregnant women and those trying to get pregnant can safely get any vaccine that's available. Also, the earlier the better while pregnant.
So if you're 39 weeks pregnant, it's already late to get the vaccine. Ideally, you want to have it early enough where you can be fully protected by the time you deliver, by the time you're in that second and third phase of pregnancy. Because we know that these antibodies can protect the baby and pass through the placenta, that's another reason why women who are pregnant shouldn't wait until the very last day of pregnancy to get this vaccine. Earlier is better.
Dionne-Odom says it's important to compare the risks of infection versus vaccination, and hopes that these latest findings will encourage more people to get vaccinated, especially pregnant women.
When you compare the risks of COVID infection itself in pregnant women, which we know are important and significant, to the risk of vaccination, which is the safety of vaccination looks very reassuring here. This, we hope, will further encourage women and providers who've been wanting more pregnancy data. This provides some of that data, and it's very reassuring.
Putting the Valley first, Nixon Norman, WZDX News.